This is a presentation on breast density awareness. Today we are going to discuss the meaning of mammograms and the definition of dense breasts and how density relates to breast cancer, and we will also go over the different categories of density and the best screening options. I first wanted to begin with a definition of a mammogram. A mammogram is a low-dose x-ray of your breasts, and during a mammogram your breasts are placed between plates and images are taken of the entire breast. Mammograms are primarily used to find breast cancer, and they can often detect cancer before a lump can even be felt, and they are also the best tool for determining your breast density. What is breast density? Breast consists of 3 types of tissue, and breast density is the amount of these tissues in comparison with each other. The definition is the amount of fibrous and glandular tissue in a woman's breast compared to the amount of fatty tissue. And in the mammogram image on the right here, we see this white part, which represents dense breast tissue. As I mentioned in the previous slide, there are 3 types of breast tissue. The first is fibrous tissue, which can also be referred to as supportive or connective tissue, and it's the same tissue that ligaments and scar tissue are made of. And second, we have glandular tissue, which is the part of the breast that makes milk, and it contains the lobes and the ducts. Lastly, we have fatty tissue that fills the spaces between the fibrous and glandular tissue. It essentially gives breasts their size and shape. So again, breast density is the amount of fibrous and glandular tissue compared with the amount of fatty tissue. Women that are more likely to have dense breasts include younger women, women who are pregnant or breastfeeding, women on hormone replacement therapy, and women with a lower body weight. Your density does change throughout your lifetime, and as you age, your density tends to decrease. So in its relationship to breast cancer, the denser your breasts are, the higher your risk of getting breast cancer. Also, the denser your breasts are, the less likely a mammogram will be able to detect it. And about half of women have dense breasts. 40% of those are in category C, and then 10% are in category D, which would be extremely dense breasts. So again, breast density is a breast cancer risk factor, so the higher the density, the higher risk. As we can see here, 71% of breast cancers are found in women that do have dense breasts. So as I mentioned, there are 4 categories of breast density. The first is fatty replaced. The second is scattered fibroglandular density. Third, we have heterogeneously dense. And last, we have extremely dense. The first category is fatty replaced, and this is when your breasts are made up almost entirely of fatty tissue. And we would call this idea visibility, and this is represented by our sun graphic here. As also on the right, we can see the mammogram is very transparent with barely any white. The next category is scattered fibroglandular density, and this is when breasts are mainly fatty tissue with some scattered areas of dense tissue. This would be generally good visibility. As we can see, we have some clouds in front of our sun graphic, but you can still see the majority of it. And also on the mammogram, you can see it's still pretty transparent, but you do have a little bit more of that white coloring. The third category is heterogeneously dense, which is a mixture of fatty and dense tissue. This has limited visibility, which is represented by the increase of clouds in our graphic, and you can see on the right here, the mammogram has even more of the white coloring. The last category is extremely dense, and this is when the breasts are composed almost entirely of dense tissue, which would be the fibrous and glandular tissue. There is almost zero visibility, and as we can see in our graphic, we are no longer able to see the sun, just the clouds, and the mammogram on the right shows how almost the entire breast is that white coloring. Can you find the cancer? As we see here, we have our varying categories of breast density, starting with fatty replaced, then scattered, heterogeneously, and the last is extremely dense. The dot here represents cancer, and as you can see in our graphic, the more dense the breasts get, the less visible the cancer is. This is why cancer can sometimes hide in women with dense breasts, even if they still get their normal mammograms and screenings. So as we saw on the previous slide, dense breast tissue on a mammogram is white, and cancer also appears white. Therefore, the more dense tissue you have, the more difficult it is for the mammogram to find cancer. If you don't have dense breasts, a mammogram will find around 98% of cancer in your breasts. But if you do have dense breasts, that percentage decreases to less than 50%. If you do have dense breasts, it is important to discuss additional options for screening with your doctor. There are other screening options besides a mammogram, and the first is an MRI, which is best for high-risk patients. And here, high risk means those that have dense breasts, genetic factors, or a family history of breast cancer. Another option is molecular breast imaging, which is ideal for density categories C and D and is becoming a more widely available screening option. Lastly, we have a handheld ultrasound, which is best for young and pregnant women and can be used in combination with a mammogram. So the best thing to start if you don't know your density status is to go get screened. Make an appointment with your primary care doctor to discuss your risks and screening plans. Tell your friends and family about breast density and how important it is in relationship to breast cancer. And lastly, if you do know you have dense breasts, make sure you follow up with your regular screenings and keep engaging in healthy behaviors. Thank you.